have a New Mind trainer, and you've got that little jack on there that says Photic, and you probably never thought about it, or maybe you did. Maybe you didn't know it was there. Some of you have taken advantage of it. Rob got some glasses, plugged it in right away, and has been doing it for a year already. So Rob took big advantage of it. It was a whole new dimension for him to add to his training. And we've been using it for 2 decades clinically. And we've done brain mapping with it. So we've spent decades mapping people, doing photic, looking at the effect of photic on different kinds of maps, looking at how people respond, doing photic before neurofeedback, after neurofeedback, during neurofeedback, between sessions, and just been learning all about it. And it's a wonderful adjunct. And of course, I've worked with Dave Seaver for many years on Photic. We've spent endless hours talking about it, looking at the research, and I've made suggestions for some of Dave's stuff, which he's adapted, which has been nice. But Dave has his own vision. All of us who are vendors have our own vision of how a technology should be implemented, and as a consequence of that, we have to design that into the equipment. You just can't make stuff up and hope it'll do it. So based on what we've researched, hopefully we've designed all of these different equipment in a conservative way that we know works, that's safe, effective, and simple. Now, there's certainly lots of ways you can innovate with Photic and go on and on forever, and there's very little research on the more complex innovations. We try to keep it down to the basics. So you plug your Photic glasses into this spot, and you can now do Photic with New Mind. And what we do is we typically start people training with neurofeedback, and then the Photic glasses start up, and they aid or assist people in training with neurofeedback. And I used to say it's training wheels for neurofeedback. I started with that line back in 1998, and it kind of caught on. And the Photic can help sustain the neurofeedback. Now the question is, will Photic help neurofeedback training go better if you do Photic with it going constantly, or would it be better if Photic only came on when people were above threshold or below threshold of the frequencies that you're trying to influence? We did a lot of experimenting with all of that over several years, and what we found is that although some people may do better if, for instance, they're trying to get their beta up and the Photic increases when the beta goes up, or if they're trying to get the theta down and or the alpha down, the SMR increases. But really what we found the most is that just constant driving with the Photic in the frequency you want is generally the most effective overall when you're doing neurofeedback. And although there are exceptions, we're using a more conservative approach, and we're going to do neurofeedback with a frequency that's helping you do the training you're doing. So the New Mind map system, when you upload data and download a map, it gives you neurofeedback protocols, but it also gives you Photic protocols, and you can add those into your training. What we did is we made it so that when you pick the protocol, you may pick protocol 7 or protocol 9, the Photic protocols are automatically loaded in for that protocol to give you optimal outcomes. We've done a lot of experimentation and research to figure this out. And as a consequence, you don't have to worry about any of that stuff. If you want to use the Photic, you just plug in the glasses and you go and push the Photic button. And we'll show you what I mean by that. And we'll get to the research on this a little bit. But what what I found is in these kinds of situations, like in the lunch and learns, people just want to know how to implement the technology. I can go on for hours about the research. People yawn, their eyes glass over, and they're like, yeah, but how do I use it? So I'm going to focus on that more today, but I'll go over research a little bit towards the end if we have time. That's something that I really hit in the workshops. So if you really want to know all the research behind it and everything, come to a workshop we have periodically. Now, here's the new Mind training screen, and you can see it says entrainment right there. Hopefully you can see that with the big arrow. And it's got a lightning bolt next to it. So you start up your session, all you have to do is hit the start button. And if you load it in one of the standard protocols, it should give you what you need. So there's a closer look so you can see it. There's the button. And when you push the button, it gives you a drop down. And it's laid out very simply. You have a maximum or minimum brightness. And we recommend putting the brightness down very low for starters, because a lot of people are photosensitive. Now, you don't want to use photic with anybody who has seizure disorder or a history of seizure. If somebody has recently had a head trauma, I wouldn't jump right into photic. Give them a few months to stabilize and do a little neurofeedback with them first, and then add the photic. We rarely have seen negative side effects from photic. It's unless you really abuse it, it's a really safe technology. In 20 years, with all these hundreds of clinics, we've had very little negative side effect with the photic.
I might add, Richard, if someone's taking one of those anti-seizure medications, but they don't report ever having had a seizure, but the doctor's got them on it, maybe you want to check with the neurologist or prescriber first before doing it then.
Good interjection, Rob. I agree completely. Now, in the lower right-hand corner, I've got an image which I borrowed from Dave, where you can see how the photic affects people, and this is a little bit more complicated than you might think. It's probably the hardest thing to get. But if you look down here, you've got left and right eyes. Okay, and I will give us a little light. There's the left and right eye. And if you notice, for each eye, there's an A and a B here. The two A's are one eye field, and the two B's are another eye field. So each eye has a left and a right eye field. And the glasses are set up so that you can train one eye field in one frequency and the other eye field in the other frequency. Now, Dave Seaver has the patent on this. You may see it in other devices, but he's the one who patented that. And he felt that might have a real advantage over just giving both eye fields the same frequency. And it does to some degree. So if you train, A, well, that might go and do, the left eye field. And if you train B, that would do the right eye field. I mean, the right hemisphere. So A does the left hemisphere and B does the right hemisphere. Now, that's not exclusive. This photograph makes it look a little bit exclusive, but there's actually a fair amount of crossover between the eye fields. And nature probably did that on purpose in case you lose an eye. So you can influence the hemispheres separately, but to a limited degree, because there's leakage here. And your brain will do what it wants to do. I mean, you can drive this photo, you can put the brightness up as high as you want, and your brain, if it's not ready to do anything different, it won't do it. I mean, it'll just ignore the photic. So it's not quite like a drug. It's a little bit like a drug, but you notice with a lot of drugs, if your systems are ramped up enough and you give somebody alcohol or Ativan or Xanax, it might bring them down a little bit. But if they're really ramped up, it takes a lot, because your body and your brain just says, no, we're not doing that today. So it pushes back. The brain pushes back. It can do it better with photic and does it easily with neurofeedback, not as well with drugs. So you're looking to see how well the brain responds when you do the photic or with the system. Now notice it says left side here, and then it's got a little thing that says right hemisphere. And that's because you're doing the left eye field, and that's going to affect the right hemisphere. And then the right side, the left hemisphere. So I have 16 hertz, and some people will say, oh, that's going into the right side. No, no, no. That's going into the right eye field, and that's going to stimulate the left hemisphere, and vice versa for the left side. So that's the trickiest thing about setting up Photic. You have to remember that, and that's why we put it this way with these parentheses. You won't see that most other places because they're not thinking about this that much, and they're not thinking about how easily you can make that mistake. And then there's a drop-down menu for the presets. Now, I told you if you load in a protocol, it'll preset it automatically in these fields and give you what you need. But you can change it any way you want. You can go up a frequency or down a frequency. We may give frequency increments. We didn't want to get into that right away until people got more savvy about Photic. And then we'll put another level where you can, another drop down where you can refine the frequencies more. One of the things you can do with Photic, one of the interesting things you can do with Photic, is if somebody has a lot of theta, you can photically entrain them just off, we call them offsets, off their main theta frequency, and you can sometimes disrupt that theta. What we found, if you take a multiple of the, let's say you've got 5 hertz theta, that's in the 25 microvolt range with eyes open on some kid. You take you multiply it by 3, get it up to 15 hertz, so it's a harmonic, and then do the offset on the harmonic. And a lot of times that'll start to collapse the elevated theta and bring it down. And not a lot of people have done work with that, but if you would play with it a little bit based on the harmonics, you can actually cause cancellation effects. And they aren't, you know, dramatic. You can bring down the theta, 5 microvolts or something, and it'll vary up and down. But when you're doing neurofeedback while you're suppressing theta, while you're doing that, sometimes it can make a real difference. So that would be a more advanced way of implementing Photic. And of course, we'll program those advanced features in a very simple way. So you just identify the frequency that you want to get rid of and push the button, and it'll automatically find the right thing for you. But we don't want to get that far ahead of things. We're introducing this technology in this way first, in a careful way, hopefully.
So Dr. Soutar, just to make an illustration of that, your brain system would say that someone needs, say, less of the low alpha and more of the higher alpha. How would that work in terms of left and right eyeball with alpha if you're wanting to increase, what, 9 to 11?
Yeah, if the alpha is, let's say you've got 8 hertz alpha, I mean, a lot of times you can increase that by just, and the map system figures this out for you. You can just train up at 10 hertz and that'll bring it up. If you have 12 hertz alpha and you wanted to bring that down, you might take a harmonic like 20 hertz and then go 1 hertz offset. And it won't be the same for everybody. The offsets are, you go 1 hertz, 2, up or down, to find what their offset is. That's the thing. Sometimes you have to play with it a little. If you're just starting out, really the simplest thing to do is just use the protocol that the map kicks out automatically and automatically loads in. But again, that's what the workshop is for, is to discuss this stuff in more detail like you're asking. And we won't get very far into this if I start going into all the theory in detail. I just kind of want to get a bit of an overview here. Now we have another unit that's a standalone unit, and we did that on purpose. It's called the Zion XL. Dave Seaver helped me build it, and we've loaded it with specific frequencies meant for training clinically. Now Dave and Photosonics, and some of the other manufacturers make equipment that do all kinds of fancy things, you know, and sometimes I think they're down in the basement just pushing buttons saying, hey, well, this one made me feel giddy, and this one made me feel kind of sad, and you know, so they're basing it purely on a subjective response without any measurement or mapping. Now, Dave is pretty careful about doing research and mapping things, so he's more sophisticated than your average vendor. But the David unit, as it was designed, had too many variations in all the settings. As a clinician, if I want somebody to do 10 hertz, I want to know that they're only getting 10 hertz, and I want them to, I want to know it's the way that, you know, that's consistent and it doesn't vary, because if I have too much variation, then I won't know what's working and what's not. So all of the frequencies are pure frequencies in here, and they're sine wave frequencies, so they're very direct. Sine wave frequencies are very specific. They tend to target more specifically the frequency you're trying to get than square waves, which produce a lot of harmonics. So sine wave is a little bit like a military rifle, and square wave is like a shotgun when it comes to affecting harmonics, targeting them. The way this unit's set up, it's set up for home, so that people who don't want to be in drugs, who are trying to get off drugs, can use a unit at home to help manage their anxiety or their depression or their sleep problems between sessions. And then you can control what it's doing, which you can't do with a drug, and you know what it's doing, and you can target the frequencies you need and help them out. Now, we know from research, for instance, published research, peer-reviewed journals, that training theta up can enhance memory. Training SMR up is very effective at reducing depression. Training alpha up is very good at reducing anxiety. And training beta up really stimulates blood flow and helps people focus. So there's some good research on all of these. And published. Now, it's not large group design. No, you're not going to get that with any innovative technology unless a drug company gets involved. But they probably will with these technologies before long. The Photic's getting a lot of attention all of a sudden. People are doing it with MRIs and stuff. But in our unit, we typically recommend that people just plug the glasses in and put the glasses on. You can use the headset to listen to music if you want, but you can use your earbuds to listen to music with your iPod. These units will do what they call binaural beats in the ears to kind of assist the photic frequency you're doing with the glasses. But you know, we've done a lot of research on this. The auditory binaural beats produce maybe about 5% effect. You can use them, but they're slow. When you put glasses on and turn it on, you know, within 10 seconds, you have a powerful effect similar to a drug. It immediately changes the brain and its distribution of EEG. Of course, you turn it off and it goes away, but there is an after effect, and it does have an effect for a few hours afterwards. And if you do it consistently over time, like every day, it slowly has more and more of an effect. The other nice thing about something like the Xeon or Photic units is that if you're training somebody and you know, there's a couple of days between sessions, you can use it to help. Let's say you're trying to get theta down, you can run some Photic, maybe some SMR, get that theta down, or some beta, depends on the person, and they can do it between sessions, and that helps condition their brain, and they do better. For people who finish doing neurofeedback, like myself, I use Photic, you know, once or twice a week just to tune up. It's fantastic. Really, really improves my mood, my focus, relaxes me. Terrific technology for that. I've been doing it for 20 years. It's been great, really. So this is so easy to use. People just plug the glasses in, they click the on button, which is right here, and then they pick one of these buttons. You tell them as the clinician which one to push. So it's a 2-button thing. Turn the thing on, push one of the buttons, put the glasses on. That's all there is to it. That way they can't screw it up. And people are really good at screwing it up.
I know that Rodney had a particular question about depression in photic, so hopefully that you've answered that. But if Rodney, if we haven't, make sure you ask the questions you wanted to about the use of it with depression.
Yeah, David Canner published years ago an article on it, and a nice little control group design article, and it was it really should have gotten more attention than it did. I was surprised more people didn't pay attention to it, but there's been new stuff in between. So you have a unit that you can use in the office, and you have a unit which people can take at home. You can lease these, sell them. I have to tell you, after working with this technology for 20 years, training people at Photic and Theta will put most people with insomnia or sleep problem to sleep. Some of the worst sleep disorders I've ever seen have responded to Photic. You can put this device on, lie in bed, and it will turn itself off. It's timed, and it'll put people to sleep. I mean, it is an incredible sleep tool. It's better than most of the other sleep things out there. So really a wonderful tool. Now, of course, there are people who don't respond to it, but they're a real minority. Most people are shocked at how good it is at putting them to sleep. I gave one to Susan Blank, and she said, "Oh, this thing's flashing bright lights in my eyes. How's it going to make me sleep?" And then she put it on and laid down and knocked her out instantly. She said, "Wow, that thing's powerful." I said, "Yeah, for most people, it's very effective." So great tool. All right, so let's move on a little bit more. How do you know what frequencies to do with a standalone unit? Well, right here, we've got them listed. So these are the pure frequencies that we tuned in. You get the unit, you can just, there's 2 levels, and we put a second level in for more complex cases, but the first level is what most people use. So you just turn it on and push a button, and you get that frequency. What do these different functions do? Well, there's a positive center frequency, the smiley face, that normalizes EEG distribution by centering the dominant frequency of the spectral distribution of the brain, and it calms beta heads down nicely. And I've got maps. If I get a chance today, I'll show you one where you can see that, turning the Photic on normalizes the distribution in the brain at this frequency. There's another frequency that normalizes the asymmetry to reduce negative moods. When I got Dave to try it out at the office, he said, "Wow, that really boosted my mood." He made all the employees do it because he said they were all cranky at wintertime. So he really liked that one. Twilight state helps to integrate trauma by moving the brain into the Schumann resonance. So it can produce states like alpha theta. It really can. I've had crossovers just running the Photic and twilight state. Of course, I did training for a while, with alpha theta before I discovered that, but I've seen it do people just randomly do it. The sleep aid is excellent to use to help reduce sleep. And then there's a focus, which aids in improving calm focus, also helpful for slow alpha depression, like I was saying. So those are the basics. I mean, we're not trying to get at everything. We're just trying to have a general effect. I won't get into this too much, but this is software that you can actually use to customize that. If you really get into this, you can customize it. Dave designed the software, so you can go in and customize the Zion, the frequency and how it moves around and how many frequencies come and go, and square wave, sine wave. You can really get lost in it. How I usually use the standalone is I will hook somebody up and put a sensor at CZ and just monitor, neuromonitoring. Just monitor their EEG for a minute or two, and then using standard, component filters. And then I might start with a 10 hertz and run that for 2 minutes, and then move to maybe 14 hertz, run that for 2 minutes, So you just go through the buttons, the smiley face, the lightning bolt, etc., and do that until you get the shift in frequencies you're looking for. You start to see theta come down or beta come up or alpha increase in frequency, and then you can send them home with that. But if you don't want to get into all that, you can just use the protocols that are recommended on the map. So we've got an out for you if you don't want to dig too deep into this. Now, when it comes down to using standalone photic, the optimal session length is about 15 to 20 minutes. And clients can train several times a day. Training can be done every day. It's not a problem. You don't really want to go longer than 45 minutes. Longer is not better. You know, I know Americans think bigger is better, longer is better, farther is better, higher is better, but that's not true with the brain. You would want to shorten time when you're using higher frequencies because that really stimulates blood flow. There's good research on that. Train with eyes closed for optimal results, but you can train with eyes open, and we use it as a booster with neurofeedback with the new Mind Trainer with the eyes open, and it works quite well. As I said, binaural beats are, don't produce much effect, so we just mostly use the glasses, and the visual stimulation creates most of the effect. And you can use colored lights. I don't. I tend to use mostly just white. And red square waves can actually trigger a seizure. Most people, when the research was done on this, actually liked purple or blue for a calming effect. And green light is most absorbed by the eyes of any light in the spectrum, so that can have a nice effect too. We use mostly white light, but you can use red. One of the things that people don't realize about photic, and even Dave didn't talk about it, most people didn't talk about it, but the lens people kind of stumbled on it. I think they kind of missed the boat, in my opinion, a bit. But one of the things that we really didn't realize is that there's a PEMF effect, pulse electromagnetic effect, and there's a photobiological effect when you're using photic stimulation, even with white light. Now, as you can see the distributions here, you can see the different distributions of white light versus different individual spectrums. Something around 635, if you're using red, can actually penetrate the scalp and get down deeper into the brain. But you can influence people with white light. In other words, you can put a white photic light on somebody's head and put it on 10 hertz and have them close their eyes, and they'll produce more 10 hertz with it than without it. And I use it for people who are photosensitive. I just put the glasses on top of their head and it penetrates. Now, if you want better penetration, you should use red. If you want optimal penetration, then you should go buy a Vilight and talk to Marvin about that.
So, Richard, if you're using it on your head, would you use the same settings that come up with the protocols per se, or would you specify?
No, use the same settings.
Take it off your eyes and put it on your head.
And watch, you'll see it has an effect. Now, part of the effect is not just the photobiological effect, because that's going to be there, but it's not going to be as powerful as something like the Vilight, but it will be there and it will have an effect. The PEMF effect, pulse electromagnetic effect, is much more powerful. If you actually, and you can check it out yourself. You can take a tri-field meter and put it on the glasses. You can put it on a Vilight. You can put it on different things and see how much energy you're getting out of it. The EMF intensity ranges from 2 to 5 milligauss with the Photic glasses that we use. The FDA says you don't really want to get higher than 2.5 to 3. Is that conservatively speaking? So those glasses will run at a pretty peak EMF intensity. I'll go higher actually, but So again, you can turn them up, but I wouldn't turn them up all the way if you're using them on top of somebody's head. And in the eyes, obviously, people are really sensitive, so you don't want to get too high because you're both getting EMF and photic effects. And intensity is safe and below 1 microtesla, which is max that you would want. Okay, so that's the PEMF component. When you put these glasses on and you're training somebody, you're stimulating the orbital frontal region, area 10, Brodmann area 10, with PEMF. You're getting some degree, because the scalp is thinner there, especially around the eye sockets, you're getting some effect in there from the photobio effect too on the frontal lobes. So really what we should have been doing in the past, and nobody did, was try to sort out the difference between the PEM effect, the photobio effect, and the effect of the pulsing light, on areas 18, 19 in the brain, in the occipital cortex, and how that drives the brain. That would really be very helpful, in terms of sorting all this out. And one of the ways you could sort that out to some degree is start putting black tape over the lights while you drive it, see what happens. That's actually what Len did, and but he attributed the effect to a frequency he found that the amplifier was putting out. But nobody discussed or tested the PEMF component. So that remains an unanswered question, and I suspect that that has more of an effect than anybody realizes. So here's a picture, a visualization of a pulsed magnetic field. So you've got these are the energy lines and how they shift around in a pulsed magnetic field, magnetic field lines. PEMF studies, there's more than 2,000 double-blind university level medical studies that showing that PEMF is safe and effective for a variety of medical reasons. I have just posted here showing you the different frequencies that they use on PEMF devices. So you can buy devices where you can tune in your PEMF pulses. The ones that have been recognized as effective with the nervous system. So people doing neurofeedback would be more likely to use these different frequencies. Again, and so there they are posted there. You can see they're all within brainwave frequencies. Very interesting. Really interesting study. I'm not going to get into that too much here. That was done with stroke, a 4-week double-blind placebo-controlled study in Munich with an N of 50. And just the short and quick of it is that they found it had a very, very pronounced effect in enhancing function in people with stroke. So it's clear that PEMF stimulates cellular metabolism, increasing TMP and flow of ions across cell membrane, affects growth factors, tissue repair, and healing. The main thing is PEMF increases blood circulation, and you can see that for yourself. You can put Photic glasses on somebody's eyes, and they just go up to them with a meter that reads the infrared output, and you'll see that the front of the brain starts to heat up and show more blood flow. We actually hooked it up to Herschel Tumum's device decades ago when he first invented it. We found, obviously, you run Photic and it increases brain blood flow, just like if you train beta to theta ratio. So it became obvious to us that if you're training beta to theta ratio in kids with attention deficit and you're running Photic at the same time, you're hitting them with PEMF, Photic, and EEG all at the same time. And it really has, an enhanced effect, creates a synergy, obviously. One of the other things is that PEMF increases ATP output, increases oxygen uptake, affects changes of calcium, sodium, and potassium in the cell, causes changes in enzyme activity and cellular pH. This is somewhat similar to the effect that you're getting with the photobio. You put the Vialite on and it's going to enhance ATP output and reduce inflammation by and increase blood flow. It enhances capillary activity, and PEMF is documented to increase capillary growth, which is why a lot of chiropractors are using it for people with injuries and problems. So running the glasses at the, at the eyes there and hitting up the frontal lobes with this is really stimulating them nicely. But hey, why not put it on different parts of the head and stimulate those areas too? So when you're putting the glasses on someone's head, it's mostly the PEMF effect that you're getting. Again, if you use red glasses, you're going to get a little more penetration. But if you want to get true penetration deep, like you'd have to go to something like Vialite. That's where they use very special LEDs at a particular frequency in order to penetrate deep down. And here's some of the things that PEMF does, and I won't get into all of this again. This is part of the workshop that we do, but you can see that it has quite a variety of effects. We noted that people with low ATP, if they're doing Vialite, they need to take supplements of ATP, or the Vialite can actually wear them down, even though it helps them out. It can tire them out without the ATP support. So I would recommend looking into that. So some of the benefits of PEMF, you can see reduces pain, blocks pain, reduces inflammation, increases blood and lymphatic circulation, increases cellular membrane permeability, cellular metabolism. In general, very positive effect these glasses are having. Photobiomodulation, we measured the Vialite. We saw it was putting out 10 to 20 milligauss, so it's powerful. Those LEDs are really cranking out energy. So there's a strong PEMF effect of the Vialite too. I mean, that's a powerful field it's putting out. So with the Vialite, you're getting both the bio and the PEMF, and I'm not sure how much research has been done to sort that out. You can contact Marvin Berman and ask him. He's kind of the guy who's been doing it with neurofeedback the longest of all of us. He knows the most about that side of this technology. Some very good research on it. But you can place the glasses directly over a bilateral training site, select a frequency output. It operates at a fairly safe level. You're getting frequency ranges with white light from 390 to 700 nanometers, which is getting up into the red spectrum a bit. And there's a couple of names for photobio. One is low-level light therapy. It's, again, increases microcircularity, vascular perfusion, similar to PEMF, same kind of thing. And I'm wondering if these, if we haven't done it, it needs to be sorted out a little bit more. So we had mitochondrial output increases, more ATP is produced by the mitochondria, and you can see the frequencies that tend to do that. And, of course, there's people who claim to have a better frequency range than other people when they sell photobio devices. Reactive oxygen species produced in the mitochondria when they absorb the photons from this kind of therapy. This triggers mitochondrial signaling pathways, leading to a cytoprotective, antioxidant, anti-apoptotic effects in the cells, basically saying that it reduces oxidative stress. So the LED components are very useful too. And I'm not going to get into this too much tonight because we don't have a lot of time, but there's some good research like Hamblin 2016 showing the tissue-specific processes of PBM. We've also seen that running gamma, there's There's some early research indicating it may be effective at reducing the effects of dementia, particularly Alzheimer's, and enhancing connectivity. So that's a kind of neat thing that we need to look into more as we move down the road. Here's somebody doing alpha theta, and they're having trouble getting a crossover because their alpha's so high, and they got a busy mind. And there's the map. They're showing the alpha, and then we run the photic at 7.8 hertz, and you can see that, boom, they get a crossover. So that's what the photic's good at. It can enhance training function, assist with alpha theta, or with getting beta up and theta down, or things like that. So I'm just going to flash back here a little bit. Again, this is all little bits from the workshop. And if I can get, here's an interesting idea of how photic can affect somebody. This is somebody with OCD. On the left is just their baseline, and then the right is turning on photic, and look at how much it just eliminates the 2, 3, 4, 5, and 6 hertz, just gone. And in this case, reduces the high frequency beta in this map. So it's normalizing the distribution. That's a standard pattern that we see a lot in photic. You can see that pattern here. The photic's running, gets rid of low frequency. It's stimulating harmonics. In this case, we're probably using a square wave. And we use it, I go into some of the research on how we experimented with and without photic with different people, with driving photic, like Brainmaster does and so forth. Here's a real quick one of, let's see, this one's even better. Here's somebody with low alpha, and we run and low theta, and we run photic, and it normalizes the alpha nicely. Here's another one where we run 10 hertz, and it normalizes the distribution. This person's got low beta. Classic pattern you see with attention deficit, and then boom, the beta normalizes. You can run 10 hertz on some people, and it'll normalize their low beta. That's a hard thing to change with neurofeedback. So if you keep doing that with the training, it's really helpful. And I talk a lot about the harmonics and all of that. So we're just about out of time. I go through some of Dave's research in the workshop, and what it does here, we spent an hour or two just looking at all of the research on photic, going back, to the 70s, and all of the stuff we learned from the research. This was good research at how photic affects the brain. And then we did we used this, and then we studied it clinically for 2 decades and ran QEGs and everything like that. So we're about out of time, and I'll just unmute people if they want to ask a question or two real fast. Well, actually, you all are unmuted.
They
the
were
agenda
very well
of
behaved.
depression, how this would help with depression.
What was that?
How would this help with someone who's depressed?
It helps a lot. Like I said, there was a control group design study that showed it significantly. They used Beck inventories, and they found significant reductions in depression, and they were just running 14 hertz. You can do 14 hertz in the right and beta in the left, and get really nice reductions in depression. But you have to use it every day and all the time. Whereas neurofeedback's training your brain, in 30 or 40 sessions to normalize its asymmetry and stay that way. Photic, you have to do it again and again and again for months, every day. But it will manage it, will help.
Carl, I've used it with patients who had depression, during sessions. I didn't have a Zion unit for a standalone to send them home with, but just during coming in once or twice a week and running it during their sessions made a big difference for them. Big difference.
Right.
Really helped it.
Absolutely. Okay, well, almost out of time here. If anybody got a last question, it's a interesting group of technologies. I have to say, the Photic I found extraordinarily powerful. I was very conservative with it, but with the Violite, it didn't take me that long to figure out how good that was. Within 6 months, we had half the people in the clinic using it. It's very effective. Really helps a lot of people with their neurofeedback. And I've been able to use it on some of the most sensitive people who can't tolerate neurofeedback even. And that got me really excited. So that's a really cool technology. But also now I'm excited about the fact that, we failed to look at PEMF, but we have an opportunity, to use that with the neurofeedback, by using the glasses along with it. So lots of potential here. And pretty simply laid out in our system. So, some of you might want to order some glasses if you haven't and try it out. And Rob says he's found it really helpful.
Yeah, and with various types of patients, and as Richard's noted, I use it with most of my people every time they come in for a session. It helps enhance the sessions, and I think it actually helps, maybe reduce the number of sessions it takes to get them they're, doing well and feeling good.
Yeah, and it really has an effect right away. So they go like, wow, this is powerful, Whereas a lot of times when you do neurofeedback, they say, well, when's this going to work, With the Photic, you get an immediate effect every time they come in, and they really kind of keeps them coming in. It's a nice side of it. And, we've run Photic neurofeedback with over 150 clinics intensively for 8 years now. It really has helped, and with little side effects. So we've really looked at it carefully.
And it's a nice addition because other than those who may be sensitive to seizures or for some reason really have a lot of sensitivity to the light in general, whether it's a standalone and used in combination with other therapies, I mean, there's no contraindication with other things you're doing. It's going to help. It's going to enhance, at least in my experience, you know, as a standalone or with other therapies that people are going through.
Okay, well, that's our brief discussion and look at Photic tonight. So hope you found it educational and informative, and it's something to think about.